नमस्कार, स्वास्थ्य संवादको नयाँ एपिसोडमा यहाँलाई हार्दिक स्वागत छ। म डाक्टर सुभाष प्याकुरेल। आजको कार्यक्रममा विशेष अतिथिका रूपमा हुनुहुन्छ विश्व स्वास्थ्य सङ्गठनका लागि नेपाल स्थित प्रतिनिधि डाक्टर जोस भ्यान्डेलियर। Welcome to the talk, Dr. Jos.
Thank you very much.
How long did you stay in our country so far?
Actually, exactly 5 years. I arrived.
5 years.
Yes, I arrived end of July 2015, so just after the earthquake.
Okay. And what's your overall impression about our country? Did you find it as expected?
It has been a very interesting 5 years. A lot of things have happened in these 5 years, and so it has been exciting to be here, to work here, to meet Nepali people, work with colleagues, and so on. It has been a great 5 years.
And apart from health, are there any experience that went unforgettable to you? It could be good or bad. Any good experience?
So, of course, when I arrived, the earthquake had happened. So we were in the middle, or the country was in the middle of getting back on its feet after the earthquake. And then the border blockade started. So to me, that was a very, very special couple of months because it was very difficult for everybody. I still remember, and everybody will remember, empty streets, no cooking gas, and things like that. So I think to start here, my 5 years, that were a couple of very special months. And what struck me there was the resilience by the people, how basically they made do. It was very difficult, but everybody got on with life one way or the other. And I think that is a characteristic of Nepali people, that if there is some bad luck, people kind of scramble, get back on their feet and get on with life. That was one of the things that I observed in the first couple of months I was here with the border closure.
And over this time frame of past 5 years, what observation is your regarding change in health status of Nepal?
Of course, if you look at the health status, 5 years is not a very long period.
Okay.
But I've recently seen the results of the new mixed survey, which is a survey that is done every 5 years, done by UNICEF and the government. And actually that survey shows that the progress that Nepal had that started already like more than a decade ago, that progress actually continued. Now the country has more women going for antenatal care, for example.
Okay.
There's more healthcare seeking behavior when children are sick.
Okay.
Immunization remains a very strong program. So there are quite a number of programs that are clearly making progress and continue to make progress.
Could you elaborate some specific areas in which Nepal witnessed significant change or progress with WHO's support during your tenure?
Well, on the WHO side, we've done or beefed up our capacity, I should say, in the last 5 years to support the government, because that's what we do. We advise the government, we support the government so that the health system improves. And on our side, we have worked, for example, we have beefed up our capacity on emergencies after the earthquake in particular, to be prepared, to increase our preparedness. Hub hospitals have been trained, have been set up, satellite hospitals to feed into these hospitals. So a structure has been built so that the country, in case there is a next disaster, which we have now with COVID, that we don't need to start again from scratch. So that is one of the things that we have done. But we also have, over the years, built a very strong immunization program in support of the government. And we have people all around the country helping government staff with immunization. Not immunizing themselves, but helping with planning, helping with trainings, helping with data collection and things like that. Okay. So that's another area of work that we have worked on. And then, of course, we work more on non-communicable diseases, because that is becoming a bigger problem in Nepal, like in many other countries. Different lifestyles, people move less, sit more at desks, eat different food, less physical activity, more smoking, and so on. And all that has repercussions on health. Okay. And so that's another area of work where we supported the government and increased our capacity and work much harder now. Also, the system itself, looking at what is the health workforce that's needed in Nepal, for example.
Okay.
How should the healthcare system be financed? These are all kind of things that we have started to work on in the last 5 years, or have beefed up our capacity. And there are more issues around communicable diseases, etc. But these are just some examples.
And in your experience, what are the marked challenges which are blocking Nepal's health sector to be more public-centered?
In Nepal, so on one hand, there are a number of programs that are quite strong. I mentioned already the immunization program. There are a number of other ones that are quite strong in Nepal. On the other hand, we talk very often about universal health coverage and UHC, universal health coverage. And that means that everybody has access to affordable quality care. So there are three things: access, quality, and affordability. In Nepal, I think a lot of work has happened on access. There are more and more health facilities, hospitals, clinics, private or public. And so, of course, in Nepal, the geography is such with the mountains that it's, particularly for people living in villages, it's not always easy to get to a health facility if they fall sick. But gradually that is also improving. So on the access, I think quite some progress has been made. On the other hand, the affordability, that means how expensive is the healthcare, that is still an issue. In Nepal, overall, more than half of the cost of healthcare comes out of people's pockets.
Yeah.
So if you are a poor person and you have a serious health problem, it may ruin you. So that is certainly an issue. The other issue is about quality, as I said, is access, affordability, and quality. Quality, also there still is some work to be done. Quality is broad. It's not just the physician giving the care and providing the right care, but it's also, for example, access to the right medicines, access to the right laboratory testing, etc., etc. And of course, we all know that there are sometimes disruptions in supply of medicines, particularly on the government side, government facilities, and so on. So on the access side, I think a lot of progress has been made. Still much more work to be done on the affordability side and on the quality side.
In this connection, to take a path of universal health coverage and to talk about the healthcare financing, health insurance becomes a very important tool or vehicle.
Yes.
Are you satisfied with the health insurance system in Nepal? That's in the right direction, or it needs some correction?
I think it is good that Nepal has started a health insurance scheme because it's an insurance is a pooling of risk.
Yeah.
So if you have an insurance scheme, or if you can take an insurance, that means that if you at some point in time have a high expense, in this case for health, that expense is then paid by your insurance. Of course, you have to pay your insurance on an ongoing basis, even if you're not sick. And at that moment, it may feel like wasted money. But the moment you fall sick, the health insurance will kick in and will pay a large part of the cost that you actually have for your health care. So I think it is very important for countries to set up a social health insurance scheme. I think it's extremely important, particularly for people who have a hard time paying for healthcare. And so it has started. It is being rolled out, but we're not there yet. I think as with anything else that is new, it goes through growing pains. And so as we go forward, I think there is still work to be done to kind of fine-tune it, to make sure that the facilities that accept the health insurance also provide the quality that is expected, that the people who have the health insurance get the services that they expect because they pay for the health insurance. Mm-hmm. It's also important that actually everybody has access to health insurance, not just the people who can afford it, but also the poorest. And I know that the government has a subsidy scheme for the poorest. That certainly needs to continue because those are the people who need it most. What's now needed is further rolling it out because not yet everybody is enrolled. Even although many districts are now covered, within these districts, not everybody has signed up yet. And ultimately, everybody should sign up, because otherwise, people will select themselves. If they think they're not going to fall sick, they are not buying the insurance. And for an insurance system to work, it's important that everybody participates, the healthy people and the not so healthy people, so that actually the healthy people then, through the insurance, subsidize the care for those who need it, the unhealthy people.
Okay. Nepal has to fix many areas in the health sector. But regarding leadership in the health sector in Nepal, you might have observed frequent change in leadership in the health ministry. So what's your observation or experience regarding this frequent come and go of health ministers? So is it affecting the prolonged healthcare development?
I've indeed seen many ministers in the last 5 years, also many secretaries in health, senior people. And I think, of course, that there are political decisions behind that, and I don't want to comment on that. But in general terms, any system, any program needs some level of continuity.
Yeah.
And if you have a too frequent switch of leadership, some of that continuity may get lost. And so I think it is important that even if there are changes in people, that the overall structure, the overall plan continues, and that the direction that the country has taken for health in this case, but for any sector, that overall direction is being followed. That is always very important.
Okay. We have installed the federal system. The government has gone into 3 tiers model: federal, provincial, and local government. And many of us have been observing the lack of coordination among 3 layers of government. So what's your say on this in connection with other countries having the same practice?
The country in 2015 with the constitution made a decision that it wants to be a federal structure, having a federal structure, federal government structure. That's a choice that was made, fair enough. I think many countries in the world have a federal system. What's happening in Nepal is that they are building the ship while they're sailing, right? So a decision was made around let's be a federal country, and then things are being put in place as things go along.
Okay.
So there's not kind of a pre-planned approach, but as things go on, things are being put in place.
Okay.
And of course, if you change the whole way of doing things, there are points in time where you have some confusion, where people are used to working in a certain way for many decades, and then suddenly this has changed. Suddenly you have new structures. Suddenly there are provinces and municipalities and no longer districts and so on. That requires a change in working, a change in approach, and a change in recalibrating what every level is doing. And so, as you're saying, coordination between all these levels is very important. Coordination, collaboration, and also making clear who is supposed to do what. Okay. And I think overall we're getting there. Ultimately, this only started 5 years ago, right? That is quite a short time when you talk about changing the structure of a country. So yes, certainly there are growing pains. That is to be expected. And certainly things are not the way they should be. That's also to be expected. But I think the direction that has been taken is one where the country is firm on. I think everybody is convinced that a federal system is the way forward for Nepal. That is even in the constitution. So now the work is in front of everybody in the country to make it work. And gradually systems are being put in place. Gradually people will need to adjust to these new systems. Okay. And work with each other. And the local level has certain responsibilities which are mainly related to the primary service provision. So if you walk into a clinic or a health post, that would typically fall under the local level, under the municipality level. As you need more advanced care, it would be under the province or the national level. That's kind of the way the system is being set up. Plus, national level would give guidance, etc. But it has a lot of opportunities, because if you do this and you give the municipalities certain responsibilities around provision of care, then the local authorities, who stand much closer to the people around them than people sitting in Kathmandu, will actually be able to adjust the local needs to what the people need and the people want. So I think there are lots of opportunities there, but it will take a little bit of time for everybody getting used to this new system.
Are you optimistic that it will get calibrated over the time period, or some intervention has to be done to correct this role confusion, or having proper job description of 3D governments?
Well, quite a number of things have been done already. Yeah? I think particularly in the health sector, the roles of the different levels have been defined. So it's not that nothing is being done. The roles have been defined, but where it often requires a little bit more work is to absorb what these new rules mean for everybody. What does it mean for somebody working in a health post? What does it mean for a mayor? What does it mean for a provincial minister, etc.? So people have to get used to this. Whether more interventions are needed, possibly. I think, as I said, this is building the ship while they're sailing, and so the ship may go up for a certain distance, and then you have to maybe make some changes, and then to go for the next phase. So it will be a mix of things, but I think going forward, it requires certainly collaboration, coordination, and willingness to make it work.
Do you think this problem is affecting the COVID care as well? This lack of coordination?
I think that in the COVID response, the COVID response is difficult for every country, and we see that around the world. Every government is struggling. If on top of that you are in a situation where the systems are still being built, to put it that way, under federalism, it doesn't make it easier. What COVID shows us also is indeed the need for the different levels to work together, so that the people get the care that they need. And whether you are in a federal system or you are in a unitary system, that collaboration you need always. But in a federal system, you would even need it more, because the different levels have different roles and they need to be adjusted to each other.
To enter into the burning topic of COVID-19, how do you evaluate the Nepal's response towards COVID care?
Nepal so far has done quite well. It was very early on, it started a lockdown very early on, after the second case already, and I think that has kept the number of cases in check. Most of the cases, now we are at 21,000 plus, the vast majority of those have been among returnees, people coming back from outside, mainly from India, and those people have by and large been quarantined. So there have been issues with the quarantine and so on, but by and large it has the two measures of lockdown and quarantine that has prevented the virus from spreading. And so until there the story is good. I think we're currently, and we're now early August, we're currently at a crossroads. I think what we're starting to see now in the data is that we're starting to see a slowly pick up again. We've seen, first we have seen cases going up, that were the migrants. The number of migrants decreased, also the number of cases decreased, but now the number of cases are picking up again. So it is possible that we're going to see more community transmission. That's possible. And so how this will further go is, I think we're going to see many more cases in Nepal. We see that in every country. There's no reason to believe that Nepal would be any different. But how fast that will go and how high that number will go, that will depend a lot on all of us. If we behave the way we should behave, and that means make the life for the virus difficult, then we have a chance of kind of flattening the curve, as we say. That means keeping a distance, wearing a mask, washing your hands, cough etiquette, going to see a doctor if you feel sick, and basically isolate yourself if you are sick. So if we do all that properly, we have a fair chance of flattening the curve and making life for the virus difficult, and therefore reduce the number of people who will be infected. If we don't do that, then the virus will have a good time and the virus will infect many people. So it will depend a lot on us. The government, of course, plays a role there also in terms of encouraging people to do these things, to keep a distance, wear a mask, etc. But ultimately, it's also up to all of us.
What will be the official version of WHO regarding the lockdown should be imposed again or it shouldn't be imposed? What's your say on lockdown?
WHO, what we are saying is what I just said. People need to keep distance, wear masks, etc. How that is being implemented, that is up to governments. So WHO doesn't advocate for or against a lockdown.
Okay.
What we're saying is that we know that keeping distance and wearing masks and so on, that helps with interrupting the transmission or stopping the transmission or slowing down the transmission. We know that works. How that is being done, that depends on every country. And so if governments in quite a number of countries, including in Nepal, have at some point decided to use lockdowns to do that, because the feeling was if we don't do that, people will go on with their normal lives and therefore the virus will spread too fast. We are at the stage now, beginning August, where the lockdown has been loosened to a large extent. And I know that there are discussions going on in the press and so on. Do we need a new lockdown? That's up to the government, because when you decide about a lockdown, you not only take into account the health side of things. We also take into account what is the social impact, what's the economic impact, and so on. And so it's a little bit of keeping a balance between in how far is it important to force people to stay at home and not work and stay away from each other on one hand, and on the other hand, how large are the disadvantages of that? How much economic hardship will this give to the people? People will lose their jobs, people won't have an income, people can't go around, which also is an issue. It has mental health implications and so on. So this balance is something that the government must weigh, and the government is much better placed than us to actually make that decision. We just are bringing the elements to it, and the government puts it all together.
Okay. People in Nepal, like throughout the world, have got big impression about World Health Organization. In the meantime, they have significant curiosity. What are the areas WHO supported our country regarding this COVID care?
Yes, so first I think that some people misunderstand what WHO actually does. We, as an organization, we are advising governments. We do not make decisions.
Okay.
So that is very important to understand. And as such, also, what the WHO says is an advice. A government can decide something different from what WHO says. What we are a member organization. That means that there are 194 countries that are a member of WHO, and the overall direction, the overall support that WHO should give is decided by all the member states.
Okay.
Every year there is the World Health Assembly that brings together the ministers of health of these 194 countries, and these ministers of health decide on what WHO should be doing in the next year, and what should be the priority for WHO in terms of supporting the governments to do certain things. So, to give an example, when in 1988 there was a decision made to eradicate polio, to give that example, at global level, that was a decision that came out of the World Health Assembly. So it were all the ministers of health who jointly decided, let's eradicate polio. And then they asked WHO to put mechanisms in place to help the countries to do that. That's an example of how the system works in WHO. So what WHO does is actually on the instructions, on the requests of the member states through their health ministers.
Okay.
That's at global level. And so in the COVID situation, WHO does a number of things. At global level is, of course, collecting information, trying to understand what do we know and what do we not know from the science, bringing all the science together and turn that into advice. That's one thing that WHO does at global level. It coordinates, it collects data, and so on. At country level, what we have been doing here is we have been working with the government in quite a number of areas. A number of our staff are based in these premises to help day-to-day work. We have quite a large number of people also based in the provinces to help the provincial governments. But what we do is the whole range. We have people who help with making predictions around what supplies are needed and how many, and what needs to be ordered, so that there's enough PPE, there are not enough drugs, there are enough ventilators, and so on. These kind of calculations, so that the government can go out and buy these things. We are helping the government with data collection, but mainly data analysis. The data collection is mainly the government. To better understand this epidemic in Nepal. Who are the cases? Why do we have more cases now than we had before, or less cases than we have had before? What is the profile of these cases? How many people survive? How many people go to hospitals? These kind of data to better understand what is going on, analyze them, and so that we can also make predictions as to what are we going to see in the next couple of weeks. Or communication. We're helping the government with communication. We're helping with laboratory. The laboratories the government is running those, or has asked private sector to help. Our role is to help with the quality. Our role is to help with technical advice around which tests to use, which tests not to use, these kind of things. So these are just a couple, and then of course the whole thing around policy and strategy. Of course, the discussions around what can we expect. If you do this, what can you expect, and so on, and bring in experiences from other countries, bring in the science, and try to put it all together so that the government can make informed decisions. So it's kind of a broad range of things that we do in COVID here in Nepal, and the same thing happens in other countries.
Okay. Are you happy with the health informatics system here in Nepal regarding, let's say, health data management, introducing electronic medical record, incorporating IT platform from rural to urban areas and health institutions? What's your say on this?
We're somewhere, I'm talking in general now.
Okay.
We're somewhere in the middle, halfway.
In the middle.
We come from a system, like in every country, that's paper-based, right? So where people used to fill forms and then fax them or send them by courier or whatnot. And then that's the way it has been done traditionally. The current way that it should be done is that the whole thing would be digital. That you would basically, at the point of use, enter certain data that are then collected centrally and can be analyzed centrally and then being fed back. We're not there yet. Some things have been digitalized. There is a system on logistic management that already is rolled out. There is also an HMIS for certain data on certain diseases that's collected already digitally. But there are also other things that are still done on paper that are being slow, that are not really yet completely coordinated. So we're somewhere in the middle of a transition from a paper-based system to a digitalized system.
Okay. Are you optimistic on this?
I think yes, I'm optimistic on this, but still quite some work is to be done there. It's not yet. It won't be ready tomorrow.
Okay. What's your next plan, and how will you be supporting Nepal continually?
For me personally,
Yeah.
Okay, I've been here 5 years, so that's kind of the normal tenure for WHO. So I'm being transferred to the regional office in Delhi,
Okay.
where I'll be working in the emergency team. And so, in that capacity, I'll certainly continue to support Nepal together with 10 other countries in the region, particularly in emergency preparedness, emergency response, and so on.
Is there any very imprinting message from your side to Nepal and Nepalese people as a whole?
I think, as I said before, I think the Nepali people are very resilient. They get up to their feet even after the worst of disasters, as we have seen, and get on with life. And I think that's a fantastic thing if you can do that. And so I think that's the core of everything. Try to get up, back on your feet, carry on with life. And then if at the same time the systems that support life, be it in health, be it in agriculture and so on, if the systems can be further strengthened, I think we're on the right way.
I guess we could talk in a good range of issues.
Right.
Thank you very much for your valuable time, Dr. Jose.
Thank you very much for inviting me. Thank you.
हस् कार्यक्रम हेरिरहनुभएका यहाँहरू सबैलाई धन्यवाद सहित फेरि अर्को कार्यक्रममा उपस्थित हुने बाचा गर्दछु। धन्यवाद।